Hello everyone, myself Aditya Satpute, student of Shivajirao Zondle College of Pharmacy, studying final year B Pharm. Today I am going to explain formation and evaluation of COX2 inhibitor. I have chosen this topic for my 7th SEM project under the guidance of Akash Nalawade sir, Assistant Professor of Pharmaceutics Department. So in my project I am going to explain the cardiovascular issues associated with selective COX2, evaluation method of COX2 inhibitor, types of COX2, COX2 inhibitors available in market. So the COX2 is basically the pro-inflammatory prostaglandins through the inhibition of cyclooxygenase COX. At least two forms of isoforms of COX are known: COX1 and COX2. COX1 is mainly considered a housekeeping enzyme. It is widely distributed in most tissues where it performs mainly psychological roles like protecting the gastric mucosa, kidney function, maintenance and protection or regulation of pellet aggregation, stimulating thromboxane A2, TXA2. By contrast, the COX2 is viewed primarily as responsible for the initiation and maintenance of inflammation process with only minor psychological roles like stimulating prostacyclin PGI2 production and thus preventing pellet aggregation. Cardiovascular issues associated with selective COX2 inhibitors. COXBs decrease vascular prostacyclin PGI2 production and may affect the balance between the prothrombotic and antithrombotic isosanoids. However, the available studies suggest only that there is a potential increase in cardiovascular events compared to traditional NSAIDs. In patients taking a coaxiv agent, the recommendation is to maintain low dose daily aspirin in patients who are at a great significant risk of cardiovascular event. However, the use of low dose evaluation methods of COX2 inhibitors. The various methods are developed to evaluate drug inhibitory activity against COX1 and COX2. In vitro assays use both enzymes and cells. The most frequently used enzymatic methods are based on purified or recombinant enzymes or microsomal preparation of cell line U937. Cellular methods include human whole blood, insect cells, various mammalian cells and pellets. However, the use of different and non-standardized method for evaluation of COX1 and COX2 jeopardizes the comparison of these data between the studies. To ensure a solid evaluation of COX2 potency, at least one enzymatic and one cellular experiment using as reference known as COX2 inhibitor should be combined. Types of COX2. At present, 3 COX isoenzymes are known: COX1, COX2 and COX3. COX1 is an enzyme which is normally present in a variety of tissues in the body, including sites of inflammation and the stomach. COX1 is produced throughout the body and regulates blood flow in the kidneys, supports normal pellet for COX2 inhibitors available in market. Ssjcop Celebrex is the only COX2 inhibitor available in United States. It is indicated for the treatment of rheumatoid and osteoarthritis, acute pain and the pain associated with primary dysmenorrhea. Rohecoxib and Valecoxib were withdrawn from the market in 2004 and 2005 respectively because they excessively increase the risk of heart attacks and stroke with long-term use. Meloxicam have been released in South Africa and is one of the several so-called preferential COX-2 inhibitors, but sometimes shows more effect on COX-1. Mechanism of action of COX enzymes. COX catalyzes the formation of prostaglandins and thromboxane from the arachidonic acid itself derived from the cellular phospholipid bilayer by phospholipase A2. Prostaglandins acts among other things as a messenger molecule in the process of inflammation. So the conclusion of my project is since the discovery in 1990s, the COX-2 enzyme has arose the development of a great number of selective inhibitors with chemical diversity. I would like to thank Dr. Shivajirao Zondle sir, president of the Shivajirao Zondle College, Knowledge City, Dr. Geeta Zondle ma'am, and Dr. Nitin Mohire sir, principal of our college. Hope you like this video, and for more informative videos, subscribe to our YouTube channel. Thank you.